Hello, I'm Priscilla Meehan, Community Relations Manager with Legacy Community Health. January is Cervical Cancer Awareness Month. Today I'm talking to Legacy Medical Director of OB/GYN Dr. Rachel Robinson about preventing and treating this deadly disease. Let's welcome Dr. Robinson.
Hi, Priscilla. Thank you for having me to discuss this very important topic.
So what exactly is cervical cancer, Dr. Robinson?
Cervical cancer affects the cervix, which is the opening of the uterus. It usually starts with changes to those cells that are on the cervix. More than 13,000 women are diagnosed with cervical cancer every year in the United States.
Could you please share with us what are some symptoms of cervical cancer?
So in the early stages of cervical cancer, there are often no symptoms. The longer a woman's cervical cancer is allowed to progress without treatment, the more likely she will begin to develop symptoms. Symptoms of later stage cervical cancer can include heavy vaginal bleeding or discharge that is more than usual. Bleeding after sex, between periods, and during pelvic exams is also a symptom. Pain during sex or urination can also be a concern for cervical cancer. So if you have any of these symptoms, talk to your healthcare provider immediately.
What are some ways to lower the chances of getting cervical cancer?
The HPV is a risk factor for cervical cancer. So getting vaccinated can help protect against the types of HPV that most often cause cervical cancer. In females, the HPV vaccine helps to prevent cervical, vaginal, and vulvar cancer. In males, the HPV vaccine helps to prevent cancer of the penis, anus, and mouth. See your healthcare provider regularly for a cervical cancer screening and follow up if you have abnormal results. There are two types of screening tests that can help find it early. One is the Pap test or the Pap smear, and the other is the HPV test. Pap smears are recommended every 3 years for women between 21 and 65 years of age, or combined testing is every 5 years, which includes both the Pap smear and HPV testing.
Great. Well, we'd like to thank you so much for sharing this important information.
Thanks, Priscilla.
Thanks to everyone for joining us today.